There are a lot of new agents. There always are a lot of new agents currently at any congress you go to, which is very exciting. I think the really interesting thing we're going to see is a sort of playoff between drugs and cells. So obviously we've got CAR T cells, which are now available in the UK on the NHS as well as widely around the world in many countries, and that's very exciting. They're very active, but we're now seeing a re-emergence, I guess, of drugs that are very active in diffuse large B-cell lymphoma, particularly. And there's a number of different types. So the ones that I'm particularly interested in is the 5F9, which is an anti-CD47 monoclonal being combined with rituximab. That's very interesting because although the response rates perhaps don't look quite as good as CAR T cells, even the patients that get a partial remission seem to be doing quite well. So, it's a different mechanism of action. Maybe this is leading to more gradual increases in remissions, which is not something you generally see with diffuse large B. It usually works quickly or it doesn't. So that's an interesting drug. The bispecifics are also fascinating. These drugs that target, for example, CD3 and CD20, and by binding a T cell and a B-cell lymphoma cell, bring them into proximity and allow the T cell to work. So a similar sort of mechanism to CAR Ts, but using the endogenous T cells without any genetic manipulation. And of course, the real advantage that a bispecific would have is that as it's a drug, yes, we're seeing cytokine release syndrome, but you can introduce mitigation strategies for that, which you can't do with CAR Ts. With CAR Ts, you just add the cells and deal with the consequences, whereas with a drug, you could start at lower doses, get over any CRS at low levels before increasing the doses. So there are there are ways around making that a safer product. And what we saw in the Congress this week is that as the doses are going up in the dose escalation trials, there is a significant ramp up in activity, and that's really good news. That was seen both in indolent non-Hodgkin lymphoma, follicular lymphoma, but also in diffuse large B. So those are definitely one to watch. And then there's also some other antibody drug conjugates, such as loncastuximab, so ADCT402. We're seeing longer term data now being presented with some of their remissions that they're seeing with that anti-CD19 targeted drug being really quite durable. So a number of things I think to be watching out for.